Hello, everyone. Today I want to talk to you about crisis intervention and suicide prevention. My name is Scarlett Minner, and we're going to discuss a case study today about crisis intervention. So, when we're doing a suicide assessment, first we need first we need to use screening tools like the Columbia Suicide Severity Rating Scale or the Patient Health Questionnaire 9, PHQ 9, along with assessing our risk factors, assessing for protective factors, but also looking for warning signs because warning signs and risk factors are not the same. Risk factors obviously increase a person's risk for it, but warning signs are what points us in the direction of imminent danger that patient is more likely to carry out committing suicide. So, looking at our risk factors. So, knowing a patient's risk factors is essential in determining if a person is at an increased risk of carrying out a suicide attempt. Protective factors can lower a person's risk of suicide. However, warning signs are essential to focus on because they can be a good indicator of someone seriously contemplating suicide. A precipitating event can cause a crisis. What matters is how one reacts to the precipitating crisis, an event during this crisis. In this case, the patient is not coping effectively with his crisis. So we can have a crisis, we all go through it. It's how we react to it and our behaviors that carry through that increase our susceptibility for a crisis. So looking at our risk factors, usually our risk factors are a history of a mood disorder. In this case, this patient has a history of depression. It has been controlled with medication, but at this point, his symptoms are not controlled. He is experiencing social isolation and his mood is impacting his functioning. He can no longer go to work. He's tried, but he can't. He is using alcohol to cope with his crisis, so that's a risk factor that increases your risk of suicide. And males are 5 times more likely to commit suicide than females. So, like we talked about, we have risk factors, but we also have warning signs. And warning signs can give us a better clue. So, some of the warning signs are feelings of hopelessness, feelings of guilt, shame, anger, social isolation from family, friends. This person is not going to work. He hasn't seen his kids. He's expressing suicidal ideations. He admitted to having suicidal ideations since his wife left, and he has a plan to shoot himself. What we need to know in this point, does he have access to these firearms to carry this through? And another warning sign is talking about worrying a lot of the time. So he was talking about, worried he can't see his kids. He hasn't seen his kids in a month. He said his protective factor is his kids, but that null and voids when he says, he feels hopeless that he'll never see his kids again. He doesn't know when he's going to see them again. So those things combined help us make a decision as a provider what we need to do moving forward. So moving forward, after doing a suicide assessment, recognizing his increased risk and the imminent warning signs of suicide, I have decided to admit him via physician's emergency certificate, or as we call it in Louisiana, a PEC, for further evaluation and treatment of his mood and his expression of suicidal ideations for safety planning moving forward. Right now, our most important priority is safety for this patient. We need to make sure that he is protected from himself. I will address his need for inpatient hospitalization by expressing empathy for his crisis and how he meets the criteria for involuntary commitment to an inpatient psychiatric hospital under a PEC due to his danger to self. So he's expressing a plan to commit suicide that is an emergency. We need to go ahead and put him inpatient. But moving forward, most patients are reluctant to involuntary hospitalization. So at this point, psychoeducation about his mood symptoms and the risk he poses to himself is warranted. So this patient has a sound understanding of the reasons and purpose for his admission. It will be stressed that he can take advantage of this time to get his mood stabilized with the appropriate medications. He will have 24-hour observation for his safety and protection, so he can see his children at some point in time. So he will be here to see his kids. If he commits suicide, he won't be here to see his kids ever. So we want to take this opportunity, and I want to stress to him to take this opportunity to learn how to cope effectively to moving forward. So it's a challenging time. This divorce is going to be a challenging transition in his life, but he needs to learn better coping skills so he can move forward in this process. I like to remind patients that sometimes we just have to hit the reset button, hit the pause button, and take a break from life and regroup, so we can care for ourselves. The most important thing is we have to care for ourselves before we can be there for somebody else. I also like to use the analogy of the oxygen dropping from, when we're in an airplane in the emergency and the oxygen mask drops, and they always tell you to put your oxygen mask on yourself first before you put it on somebody else. And that's essentially the same thing with this gentleman. He's got to take care of himself. He's got to take care of his mental health so he can be of use to his kids in the future, and he can be a productive person later in this life once he gets through this crisis. But right now, he just needs help getting through this crisis. So at this point, I'll let him know that we're going to deploy a crisis intervention officer from the sheriff's department. They can come and transport him to the nearest emergency department where he will be medically cleared, and they will find him placement in a near inpatient psychiatric hospital so he can get medication management, so he can get the psychotherapy he needs, and he can get the resources he needs once he is discharged home to care for himself and after he moves through this crisis. So here are the references I used for this presentation. So thank you for watching, and this is my presentation on crisis intervention and suicide prevention. Thank you.